Hey everybody, it's Andrew here and welcome back to my channel. So today we have an update directly from President Biden in regards to lowering prescription drug costs. Now on this channel we focus on everything that affects seniors, including Social Security, SSI, SSDI, Medicare, SNAP benefits, the economy, and politics at large. But specifically, we also lately have been talking a lot about prescription drug costs. Now, we all know that Joe Manchin basically pumped the brakes on the stimulus package negotiations. We now expect a much smaller package to make it through eventually, but currently negotiations are really on hold, and we're waiting to find out what's going to be included in that package. Now, there's a lot of things that could be included, but one of the main things that we're fairly certain is going to make it in this package is some form of a bill that's going to lower prescription drug prices. So in this video, we're going to show a clip from President Biden discussing exactly why this has to be done and different things they're doing to try and lower prescription drug prices. Now, first of all, President Biden already issued a couple of executive actions which should lower prescription drug prices in the short term, and then this next stimulus package should include something that lowers prescription drug prices long term. Now, specifically in that executive action, he's now allowing the United States to import prescription medications from Canada as long as they're done so safely and from the same manufacturers that make the same drug here in the United States. He also is trying to expedite the process to create generic medications because really what happens right now is brand name medications have a 12-year patent, but a lot of times it takes even more years beyond that for companies to start making the generics. So the executive action, the point of that really is to try and get those generics out right as soon as the 12 years hits. But to go beyond that, he really wants to limit how much prescription drug prices can go up. And specifically right now, they're targeting insulin and other medications like that that really cost seniors the most. And the hopes are that this will eventually be expanded to include all medications across the board. Of course, this would specifically only apply to Medicare, but the thought here is that Medicare kind of sets the bar, and once prices go down for Medicare, that will generally lower market prices as well, which could make insurance more affordable for everyone across the board, even people who aren't on Medicare. Now, currently Medicare is not allowed to negotiate drug prices, so they end up paying whatever the market value is. And that's kind of a weird situation because the VA can negotiate drug prices and Medicare can negotiate everything else except drug prices, right? So really it's something that needs to change. And in this video, President Biden also mentions that long term, they hope to also include dental, vision, and hearing care in Medicare. But of course, we all know at this point, the main thing they're trying to push for now is hearing. It looks like dental and vision won't make it into this next package, but hopefully eventually down the road it will. So with that said, guys, let's take a look and see what President Biden had to say. Again, don't forget to subscribe. I will keep you posted as things develop. But for now, let me know your thoughts in the comments, and I'll see you on the next video.
I know there are a lot of people out there trying to turn a public safety measure, that is children wearing masks in school, almost every American can agree on. But I think it's safe to say that all of us, whatever our background, our age, or where we live, can agree that prescription drug prices are outrageously expensive in America. Today, I'd like to talk about how we're going to help millions of Americans save money and ease their burdens by lowering the cost of prescription drugs. Let me start by acknowledging the groundbreaking and life-saving work that many pharmaceutical companies are doing. Look no further than the vaccines they're manufacturing and delivering that are helping us beat this pandemic and save lives. But we can make a distinction between developing these breakthroughs and jacking up prices on a range of medications for a range of everyday diseases and conditions. Right now, right here in America, we pay the highest prescription drug cost of any developed nation in the world. Let me say that again, of any developed nation in the world. About 2 to 3 times what other countries pay. Last week in the Oval Office, I hosted a small business owner named Gail from Denver. She's 60 years old. When she was 11, she was diagnosed with type 1 diabetes. For nearly 50 years, she's had to take insulin to stay alive. But you know what she told me? She said she doesn't worry about becoming blind or her blood sugar dropping dangerously low. the natural worries of anyone with type 1 diabetes. She worries about being able to pay for her prescription drugs. During our conversation, she pulled out a vial of insulin from her bag. In 2001, she said, that single vial cost $32 a bottle. Today, that exact same bottle with the same exact formula, no changes, costs $280 per bottle. Gail and her husband work hard. They spend wisely. Because of the cost of her prescription drugs, her husband may not be able to retire. They drive the same car, she said, she's had for 17 years, unable to afford repairs or a new one. And Gail's not alone. It's estimated that more than 34 million Americans, 10% of the population of the United States, have diabetes, including more than 1.5 million of those who have type 1 diabetes. And the outrageous cost affecting everyone across the board, spanning every kind of condition and disease, is similar. I remember what it was like for my mom as she got older and moved in with us. Her prescription drugs were so expensive that it took me, my two brothers, and my sister, three siblings, chipping in to cover the thousands of dollars in monthly costs that she had to exhaust, rather than exhaust the few little savings she had for her prescription drugs. It's personal to so many of us, and so many of you. You know, for more than 1 million Americans living with multiple sclerosis, one common drug for that disease costs $7,100 per month. The price has gone up 1,000% over the last 20 years without any change in the drug. For more than 1 million people with rheumatoid arthritis, a common prescription drug used to cost about $1,350 per month. That was when it was introduced back in 2003. Today, the same drug costs $7,700 per month, over 5 times more expensive, without any change. For years, the price of many prescription drugs has dramatically outpaced inflation. These prices have put the squeeze on too many families and stripped them of their dignity. We forced people into terrible choices between maintaining their health, paying the rent or the mortgage, putting food on the table. I mean, literally. And that's the case for a lot of working families and seniors, even if you can get the care you need. But today, working families and too many seniors are struggling to make it work. Today, 1 in 4 Americans who take prescription drugs struggle to afford them. Nearly 30% have skipped doses, cut pills in half, or because they can't afford the cost. We have to change this, and we can. My administration has already taken significant steps to lower the cost of prescription drugs. I signed an executive order that has the effect of improving competition in the economy, which will result in lower prescription drug costs. Right now, when a drug company seeks permission from the FDA, the Food and Drug Administration, for a certain drug to get a patent, it's allowed to exclusively sell that drug without competition for up to 12 years. When that time period expires, other companies can come along, make the same exact drug and sell it cheaper. It's called generic drug. But unfortunately, it often takes a long time, years and years, for this to happen. That's why I've instructed the Federal Drug Administration to get these genetic drugs to consumers faster. This is going to increase competition, lower drug prices for everyone. Research shows the prices could be cut by 25 to 33% and save $54 billion for consumers over the next 10 years. Makes a gigantic difference for an average family. Secondly, I've ordered the FDA to work with states and tribes to import prescription drugs safely from Canada. These are drugs that the FDA has determined are safe and they're going to make sure the drugs get to the states and tribes safely. Colorado estimates that their version of the drug importation program is going to save $35 million to $60 million a year for people in Colorado, cutting the prices down by more than 60% for the cost of the same drug. These things, and by the way, the company that's making these drugs and charging exorbitant prices are selling the same drug in other countries at considerably lower prices. It's not like there's another company always making this drug. Same outfit. These things by themselves will be a great help. But to really solve the problem, we need Congress to act. That's what my Build Back Better plan will do. There's long been talk, a long time, since the days when I was back in the Senate, about giving Medicare the power to negotiate lower drug prices. Now, Medicare takes care of millions of people. Medicare, my plan is going to allow that. Every other type of health care service, from the cost of a doctor's, how much a doctor can charge for a visit, hospital visit, crutches, wheelchairs, Medicare is allowed to negotiate and say, we'll pay no more from the Medicare than the following amount for those things. As I've said before, the only thing Medicare is not allowed to negotiate are prices for prescription drugs. My plan gets rid of that prohibition. The proposal I made while I was running for president is that Medicare should negotiate drug prices across the board. Congress is currently debating a more narrow vision, letting Medicare negotiate some of the most expensive drugs, particularly from those companies that don't face competition for that drug. We're going to provide that competition through Medicare. Medicare is going to negotiate a fair price. Right now, drug companies will set a price at whatever the market will bear. Some of you may remember when I had the moonshot going when I was vice president, I met with 12 drug companies, and I agreed I would not name them at the time. It was just a private discussion. I said, if any one of you came up with a drug that cured a particular type of cancer, what do you think you should be able to charge for it? They said, whatever the market would bear. Whatever it will bear. That often means a significant number of people can't afford it under any circumstance, and they'll die without it. That's unacceptable. What we're proposing is that we'll negotiate negotiate with the company based on a fair price, one that reflects the cost of the research and development and the need providing for a significant profit. But that's still affordable for consumers. And by the way, if there's a significant amount that's invested in it and a fair price is very expensive, we're going to have to figure out how society can provide for that drug that will save lives if people can't afford it. But that's what we're trying to get done, and it has to get done. But not only that my plan caps the amount that seniors have to spend on prescription drugs each year at no more than about $3,000 a year, our plan says that drug companies can only raise prices based on the rate of inflation after it's determined how much they've invested and what a healthy profit constitutes. Studies have shown that if we do this, we can save seniors thousands of dollars a year. For example, an expensive drug for a cancer called multiple myeloma can cost $20,000 a month. $20,000 a month. People who need that drug pay an average of $1,300 a month out of pocket, even with Medicare. What I'm proposing would reduce the total cost by thousands of dollars, and seniors would not pay more than $250 a month on average. That'd be a game changer. And by the way, it isn't just seniors who will benefit. This would lower prescription drug prices for all Americans, and here's how. If Medicare prices are available to private insurance companies, then it would reduce the cost of employer-based health insurance coverage. What that means is, once Medicare negotiates a lower drug price for its beneficiaries, an employer-based plan shouldn't have to keep paying whatever the drug company demands. They should get access to the same drug at the same price as Medicare. So if you're not on Medicare, you get your prescription drugs through your employer-based plan, your plan should pay the same price for that drug as someone on Medicare. It means drug companies would have to sell their drugs to all distributors at the Medicare price, or face up to a 95% excise tax. The savings for employers and employees would be billions of dollars a year. We don't have to stop there. My plan expands Medicare by adding dental, vision, and hearing, which would make a world of difference for millions of people. We can take some of that savings, create it when Medicare is no longer forced to overpay prescription drugs, and use it to pay for these additional benefits and reduce premiums, improve access for people with coverage on Medicaid and the Affordable Care Act. You know, at the same time, we can invest in medical breakthroughs that will also reduce the cost and save lives. Right now, when Americans overpay for prescription drugs, too many pharmaceutical companies don't use the profit nearly enough to innovate or research. Too many companies use it to buy back their own stock, inflate their worth, drive up CEO salaries and compensation, and find ways to box out the competition. In fact, according to one study, from 2016 to 2020, pharmaceutical companies spent $577 billion in stock buybacks and dividends, $56 billion more than what they spent on all research and development over that same period of time.